Undocumented immigrants, especially in cities such as Danbury, New Haven, in the state of Connecticut, create huge strains on hospitals and the medical system. What will your proposals do to counteract this massive problem?
The S-CHIP program, this is one involving children. And there was a debate in the Senate on a particular amendment directly to your question. And that is, should we take children here who are legally here, not citizens yet, but legally here, do we cover them as part of the S-CHIP program to give children health care? I supported that. I supported giving legal children. Secondly, having a child who is not getting proper care showing up in a school system. I have a bit of a cold and a cough right now. I've got a 3-year-old and a 7-year-old. I'm living in a petri dish at home. Because every day they come back, obviously, and they're sniffling and sneezing and coughing and wheezing. And so, in a sense, having children who are not unionized, not getting proper care, showing up in a school system in the community contaminates potentially others as well. So we got to get beyond the issue in the sense of whether or not they're citizens or not. Chris, do you want to comment on that?
No, I would just say that we got to remember whether we're talking about undocumented immigrants coming and receiving services at the hospital, or we're talking about citizens of this country coming and receiving services who don't have insurance. All of those people, regardless of their status, are being paid for somehow in this system. That all those folks showing up at the emergency room are being paid for by everyone else in this room that is either paying taxes or is paying private insurance. And so I think it is a very important question that you're asking, and I think it's central to why a lot of us want to proceed forward with the parallel issue of immigration reform. But I think it's just important to remember that all of those people that we sometimes castigate for not having insurance, they're being paid for by the society as a whole, and it's part of how we lower the overall cost is by getting those people hooked up with insurance.
If I could add something to that, please. You know, I live in a community where I pay very high taxes. I don't have children in the school system. I'm happy to pay taxes. I want an informed, educated citizenry. I pay my federal taxes because I believe that there should be services. And so, you know, this issue of the same thing is said about, you know, if you don't speak English, what the heck are you doing in this country? And maybe you should, you know, make some other type of arrangement. You know, we can continue to have those fights. But we're in this together. You know, what happened on Wall Street, I have nothing to do with, but it's affecting me. And unless we stop blaming each other and start working together to really resolve these issues, we're just not going to